Eyewitness News is taking your pressing health questions straight to the experts. Joining us now is family physician Dr. Alexa Mieses Malchuk. Dr. Alexa, we're seeing a spike in cases of HMPV. Since there's no vaccine for this, what can folks do to stay protected?
Yeah, so HMPV stands for human metapneumovirus. I know that that is a tongue twister or a mouthful, but this is basically yet another respiratory virus that very commonly causes a cold. Now, if you have a suppressed immune system because of certain medications or because of certain medical issues that you have, or if you're older or very young, this respiratory illness can actually be pretty severe. Now, as we move into the summer, according to the latest CDC statistics, cases are dropping, so that's good news. But by now you may feel like a respiratory virus expert because a lot of the things that protect us from COVID and flu also protect us from this virus. So most importantly, make sure you wash your hands frequently throughout the day, but especially before eating, cooking, and after using the bathroom. And if you don't feel well, stay home. Now, I know that that's easier said than done because very often people have to go to work or you have to travel unavoidably. And so when you're out in public, please consider wearing a mask, especially indoors, as this could decrease the chances of you spreading the virus to others.
All right, well, thank you. The new CDC report that's out shows drug costs are leading millions of Americans to not take their medications as prescribed. That's not a good thing. What can you tell us about that?
This is a sad reality for many Americans in the United States. Cost is a significant barrier to health, cost of medications, and most adults in the United States take at least one prescription drug, but many take more. And in an effort to make their medications last, they may skip a dose, they may cut a pill in half, or they may only take their medications once in a while, which can really have an impact on their health. Now, some of the groups of people who may be more severely affected by the cost of their medications are those who don't have health insurance, those who are unemployed or on a fixed income, and those who have low health literacy. And I really truly believe in my heart that one of the best steps, one of the best first steps to really help navigate these issues is to develop a relationship with a family medicine physician. And I say that because as a family medicine physician, I was trained to help my patients navigate these sorts of issues. If you don't have insurance, you can still get health care for free at federally qualified health centers. And once you develop that relationship, your primary care physician can help you navigate these issues or at least link you with a social worker or a community based organization who can also support you. No one should have to go without medications or have something that they don't really have control over so significantly impact their health.
We're also seeing manufacturers adjusting doses of certain drugs to keep up with the high demand, and that includes the popular weight loss drug Wegovy, if I pronounced that right. Will this impact users in any way?
Wegovy is an extremely popular weight loss drug right now. In fact, it's prescribed to hundreds of thousands of Americans currently. So it should come as no surprise that we're running into not our first medication shortage, specifically for Wegovy. And, I think the important thing that I really want people to take away from this is number one, if you're not yet on this medication, it might not be a good time to start simply because you're going to have a hard time finding the appropriate starting doses. Now, if you are already on this medication, but you're having a hard time finding your dose, it is super important that you do not switch to a higher dose or skip ahead. This medication has to be increased slowly, month by month. And if you were to increase it too quickly, you can have pretty severe health issues. So, for example, nausea and vomiting so bad that it could land you in the hospital. It can also cause issues with your gallbladder and your pancreas. And so, if you're thinking about taking this medication or you're on this medication, please make sure you talk with your physician. There are a number of generic versions of this medication that the FDA is also warning are not necessarily safe or effective because they're not being monitored. So, again, make sure you talk with your prescribing physician. Hopefully, it's your primary care doctor about whether Wegovy is right for you, or if you're having a hard time finding it, what some safe alternative options may be.
All right, great information. Family physician Dr. Alexa Mieses Malchuk, thanks once more, and we'll talk to you again.